It's a pleasure to have you here. The details now. Ghana is expected to receive 300,000 Russian-made Sputnik V vaccines this week to get our vaccination program back on track. The country has struggled to keep to its plan following supply cuts from India. The Asian country is the main producer of AstraZeneca vaccines, but is struggling to cope with demand at home and deal with significant surge in COVID-19 cases. Speaking to journalists on the sidelines of an event to mark the 11th Africa Vaccination Week in Ghana, Health Minister Menu said he expects delivery of some 300,000 doses of the Sputnik V vaccines this week.
We are trying to make efforts to try to get in the country some Russian-type Sputnik. Though we have made initial approaches and expecting some shipments to come in. They demonstrated availability and brought in the first 160,000, which is kept there, waiting for about 300,000 to come sometime this week. We were expecting about 2-3 weeks back, but we have faced challenges with vaccine availability and payment structures and things like that. I believe sometime this week we may receive the 300,000.
Now, even though more countries are turning to the Russian-produced Sputnik V vaccines, a latest report by Brazilian health authorities questions its efficacy. Dr. Yabediako, an immunologist with the West Africa Center for Cell Biology of Infectious Pathogens, WACBIB, is here to explain to us what this really means. Thank you so much for your time here, Doc. So let's start by breaking it down. What do the Brazilian authorities mean when they say the Sputnik V vaccine is defective?
Thank you, Bernice, for having me. So what the Brazilian health authorities have announced is that due as the result of certain further studies they have done, they have determined that it would appear as though the adenoviral vector in one of the Sputnik V vaccines. So the Sputnik V vaccine is a 2-dose vaccine. And actually, the first dose is one adenoviral vector. The second dose is a different adenoviral vector. Now, they have determined that one of the adenoviral vectors appears not to have been genetically modified to prevent it from replicating. So the way you think of it is, when you use adenoviral vectors to make a vaccine, AstraZeneca is a similar design. You genetically modify the vector, which is a virus in itself, to prevent it from replicating within the host. So when you are injected with the vaccine, the vector itself cannot replicate. So it basically goes through a single cycle and then it's cleared. It delivers its payload, it delivers the target that it's supposed to do, and then it is cleared from your system. Now, the way you do that is to genetically modify the vector to delete a particular gene to prevent it from being able to replicate. Now, what they have done is they took this vaccine and grew it in a lab, and it was able to replicate, which would suggest that the vaccine has not been modified appropriately. Now, when this happens, it creates a concern because now you are immunizing people with potentially a compromised vector that may establish an ongoing infection that may have its own consequences. So, I think the Russian Federation is disputing these claims. So now it's sort of one side saying one thing, the other saying the other. The European Medical Agency is currently evaluating Sputnik V. And I believe, it will be in our best interest to wait for that evaluation to be completed before we make a decision, because this is new information that has previously not been available. The emergency use authorization awarded Sputnik V in Ghana at the time did not have the benefit of this information. Now that these reports have been reported by a number of news agencies, including Reuters, from Brazil, and in fact, the Brazilian government have refused to approve this vaccine based on this information, I think Ghana, we have to sort of be cautious before we administer this vaccine, because if it is true that indeed these vaccines have been compromised, then we do not want them to be administered to the Ghanaian people.
So, Doc, what happens in the case of administering a vaccine of this sort? What will happen to an individual who takes the jab?
Well, it's difficult to tell. I mean, there are a couple of things that potentially could go wrong. As I said, the whole point of the genetic modification is so that the virus, the vector itself only goes through a single cycle and then is cleared. You basically do not want to give somebody, because these adenoviruses cause colds, right? So you don't want to give somebody a high dose of a virus that is capable of replicating. It is, we all hear about, when we've talked about vaccines, we always say they give you a weakened form of the virus. Well, in this case, the data suggests that this has not been weakened. And so it could create certain issues. Another problem is usually, in order for the vector to carry the spike protein, which is the SARS-CoV-2 protein of interest, you have to remove one piece of the DNA and then replace it with a different one. The fact that this virus is able to replicate suggests that it may have lost the spike. So if it has lost the spike, then it's not going to give you any protection against SARS-CoV-2. So there are a lot of unknowns. Currently, all we can go off is this initial report, but it has raised significant questions about not just the efficacy, but in many ways, even the safety of the Sputnik. And so that's why I think we need to not rush into things. I believe that we are receiving 300,000 doses of AstraZeneca vaccine this week from vaccines that were supposed to go to DRC and COVAX has now diverted them to a number of countries, including Ghana. So, AstraZeneca has no such problem. We may have some of those soon. Perhaps we use those whilst we wait for the European Medical Agency to give us another report on the safety of Sputnik V.
So in response to this, the Russian Direct Investment Fund, which markets the Sputnik V vaccine, rejected Anvisa's comment, saying the shot's safety and efficacy had been assessed by regulators in 61 countries which approved for its use. But you're just telling us that the European Medical Association is yet to finish its assessment on this. But right here in Ghana, what do we do while we wait for this? Can we embark on our own form of assessment?
So I believe that we could. I mean, the tests that were done in Brazil, I believe, are within our capacity. Noguchi Memorial Institute, it has the capacity to grow viruses. I'm sure that this is something that could be done locally to see whether or not indeed this vaccine has replicating capacity. In terms of the 61 countries, we have to be very careful. Sputnik V has not been approved by any of the large continental bodies. It's not been approved by the WHO. It's not been approved by the US FDA. It's not been approved yet by the European Medical Agency. Yes, it has been approved in a number of different countries, including Ghana. But this is based purely upon the documentation submitted by the manufacturer and the clinical trials that were done. Many of the countries, that have approved it do not have the capacity to do detailed follow-up studies. So they basically base their assessment upon what has been done elsewhere. Now, up until this Brazilian data came out, Sputnik V, and I was fully supportive of us using it because all the data suggested that it seemed to be okay. With this new data coming out of Russia, of Brazil, it raises questions. Now, it's possible that the batch that was used in the clinical trial was fine. Perhaps the batch that went to Brazil is compromised. So it may be a quality control issue. It may not be that all of the Sputnik V is bad, but it may be that there has been some issues with production. Now that still raises questions because we don't know which batch we are getting, right? We don't know if ours is compromised or not. And so as soon as there's an issue with a batch, then you pause using any of the vaccine till you've identified where the problems are. So I think we have to be very, very cautious. Given that this information has come out before we've rolled out this vaccine, I think the prudent thing to do would be to wait for more investigations, especially as it's currently under review by a highly respected European Medical Agency. Let's see what they find out before we deploy it in Ghana. Or maybe even better, let us, we have some of it in stock. Maybe we can do some of these initial lab tests ourselves as well.
All right, Doc. So you mentioned Ghana is part of the 61 countries that has approved the use of the Sputnik V vaccine. I'm just wondering how we came about that decision. Did we do the test ourselves as a country, or we basically just relied on data that's available?
I mean, that is a question better answered by the FDA. My understanding from what I've heard from the FDA is a lot of the time, especially for the emergency use authorization, it's based upon a dossier of data that is submitted to our FDA. Now, our FDA is, it has very, very high standards. It's well regarded around the world. But a lot of the decisions are based upon prevailing data that is already available. We don't have, in this country, we don't yet have the capacity to do the actual lab, besides assessing things about, maybe contamination or the like. In terms of testing efficacy and so on, we haven't run any trials in Ghana. So the data that the FDA is basing their decision on is data that is submitted with the vaccine when they apply for approval. And it's usually data that is aggregated from different places. So up until this point, all the data for Sputnik said, well, it has been tested in Russia. The tests have not been as extensive as AstraZeneca, but the results have been promising. And given that there's not a lot of vaccine around, it made sense to approve it. Now that this report has been released, I'm very sure that our FDA is looking at it. And if it does prove to be credible, they may need to revise their authorization. That is well within their rights. It would not mean they made a mistake. It's just that now there's new information available. And if they take that new information on board and they think it's credible, they may reverse their decision to license this.
And Doc, let me just mention here that we reached out to the FDA and we are yet to receive feedback from the FDA. We also reached out to the Ghana Health Service and yet to receive feedback on this, as we are told that we expected to receive some 300,000 doses of the Sputnik V vaccines. But Doc, let's come down to how this affects people's behavior towards receiving the jab. Already, we saw some bit of hesitation. There were all these conspiracies about the vaccines and the safety of the vaccines. And so, do you think this gives credence to those who say we've just rushed through this? We didn't give ourselves enough time to test the efficacy of the vaccines?
No, actually, I would say that this is the system working. The fact that the Brazilian government has paused or has refused to license a vaccine, and that data is now available, shows that in general the systems work. We are in an unusual situation. Vaccines are being produced in mass. We need to get vaccines into people. We cannot afford to delay. And so, yes, we are trying to do things at high pace. But I think the fact that this report has been released suggests that there are checks and balances. And now Ghana's FDA will now have access to the same data the Brazilian government did. And so our FDA can now make the decision also based on that. With regards to the AstraZeneca vaccine and the side effects, we made the decision to continue, as many countries did, because the risk of side effects was outweighed by the risk of the disease. In this case, this is now an issue of vaccine quality, not so much side effects, but vaccine quality. And that is another decision that we are going to have to make in terms of whether we accept the vaccine into the country or whether we don't. But I think people should rest assured the checks and balances are there. And in my opinion, provided the process is allowed to run its course, the right decisions will be made. Ghana's FDA now can request the same dossier that the Brazilians have access to, and they can make a determination. If they think that evidence is credible, then they can withdraw the license to Sputnik, or they can decide based on other information that they think it's still safe and they can proceed.
I appreciate your time here this morning. Dr. Yao Bediako is an immunologist at WACBIP, sharing his thoughts on